Welcome to Living Diabetes. Today, we're discussing a very interesting topic, remission of type 2 diabetes. Can it really be reversed? What does the latest science say? Stay with us as we explore how lifestyle changes and medical advances are giving new hope to millions. Let's get started. For many years, getting a diagnosis of type 2 diabetes has felt like receiving a lifelong sentence, a health condition that, once it arrived, could only be managed, never cured. Most people learned to expect that diabetes would progress over time, with blood sugars creeping higher, medications piling up, and worries about complications always lurking in the background. This bleak outlook has been so common that it rarely gets questioned. But recent advances in medical research are turning this life sentence idea on its head. There is now strong scientific evidence that, for many people, type 2 diabetes not only can be controlled, but can actually go into remission. In other words, it is sometimes possible to reverse diabetes, so much so that blood sugars return to normal, medications can be stopped, and people feel healthier than they have in years. For decades, scientists and doctors saw type 2 diabetes as a one-way street. Once you developed the condition, it was thought to steadily get worse no matter what you did. This view came from important long-term studies, like the UK Prospective Diabetes Study, which showed that most people with diabetes needed more and more medication as time went on. But, things have changed. New research is showing that type 2 diabetes can actually go into remission. This means that with the right lifestyle changes and medical interventions, people can significantly reduce their blood sugar levels and, in some cases, even come off their medications entirely. It's a game changer for many, offering hope where there was once resignation. But the latest research and expert reviews from around the world now challenge that old idea head-on. Some specialists even call it a great big lie that diabetes must always get worse. In fact, they argue that type 2 diabetes is not only reversible, but for many people also preventable. What does reversing diabetes mean? You might be wondering, what does it really mean to reverse diabetes? Medical experts now use the term remission to describe a situation where a person with type 2 diabetes has normal blood sugar levels for at least 6 months without any diabetes medications. It isn't just about having better control or taking less medicine. True remission means your blood sugars have stayed in the non-diabetic range, naturally, for an extended time. Let's put it plainly. If someone with type 2 diabetes changes their eating habits, loses weight, sees their blood sugar return to normal, and can safely stop taking all diabetes medicines, isn't that a reversal? According to the latest science, this is not only possible, but increasingly common, especially for people who act early and take the right steps. Achieving and understanding remission is a journey. It requires dedication, lifestyle changes, and sometimes a bit of patience. But the rewards are significant. When you understand the steps and commit to the process, remission can become a reality. Remember, it's about making sustainable changes that support long-term health. So take it one step at a time and know that every positive change brings you closer to remission. How is remission achieved? The most dramatic results come from two main strategies. Losing a significant amount of weight, often 10 to 15 kilograms or more, and making major changes in diet, sometimes with the help of meal replacement plans or supervised low-calorie diets. A landmark study from the UK, the DIRECT trial, helped shift the way doctors view diabetes. In this study, people with type 2 diabetes who still had some natural insulin production, generally meaning they'd been diagnosed within the last few years, followed a carefully planned low-calorie diet. Nearly half of them were able to stop taking all their diabetes medications and keep their blood sugar in the normal range a year later. Even after 2 years, about a third remained in remission. The more weight people lost, the more likely they were to reverse their diabetes. Other studies have found similar results. For example, a study called Diadem-1 showed that in people with diabetes for less than 2 years, many reached remission after following a diet program. Even some types of weight loss surgery trigger remission in half or more of patients. The science behind remission and who can achieve it. Why does remission work? Research shows that losing weight, especially the kind of weight carried around the waist, reduces fat inside the liver and pancreas. This is important because having too much fat inside these organs interferes with the body's ability to make and respond to insulin. When that fat goes away, many people's insulin production and sensitivity improve, and blood sugars normalize. This idea, known as the twin cycle hypothesis, helps explain why eating less and losing body fat can actually allow the cells in your pancreas to recover, especially if you catch diabetes early, before too much damage has occurred. Who can achieve remission? Not everyone with type 2 diabetes can achieve remission, but the odds are especially good for people who have had diabetes for a shorter time, usually less than 6 years. Those who are not yet on insulin or only use it at low doses and still have some ability to make their own insulin. Managing to lose a significant amount of weight and keep it off means that early action, right after diagnosis, makes remission much more likely. Imagine a future where type 2 diabetes is no longer a lifelong condition. Advances in research and treatment offer new hope. By understanding the factors that favor remission and taking early action, many people can look forward to a healthier, diabetes-free life. It's a new era of possibilities and a brighter future for those living with type 2 diabetes. In fact, the biggest reason diabetes may appear progressive is because standard treatment often waits too long before encouraging big lifestyle changes. For many people, the problem isn't the disease itself, but the way it's been understood and treated over the years. A new understanding and a new hope. If you or someone you love is living with type 2 diabetes, it's important to know that a diagnosis is not always a life sentence. With the right support and lifestyle changes, remission is a real possibility for a large group of people. Experts now recommend that healthcare providers talk to patients about remission as a goal and consider aggressive weight loss and dietary strategies, especially soon after diagnosis. Of course, everyone's situation is different and not all cases of diabetes can be reversed. But the facts are clear. Type 2 diabetes does not need to be a one-way street. For many, taking control early rather than settling for lifelong medication offers the hope of a healthier diabetes-free future. That's it for this episode of Living Diabetes. If you enjoyed the episode, don't forget to subscribe, leave a review, and share this video with anyone who might find it helpful.